Hello guys, and welcome to this video to talk about the most common, or at least some of the most common radiopaque alterations, okay, or hyperdense alterations if we are talking about CBCT, if we are talking about 3D imaging. So I have 5 cases in front of me now, and I want you guys to pause the video and try to diagnose the 5 cases, okay? And I hope you guys were able to do it. Let's start with the case on the top left of your screen, okay? So this case over here. And we are seeing that we have a well-limited alteration, okay? So well-limited homogeneous alteration as well. It's not symmetric. Actually, we can see here, so this would be the tilted coronal plane, so coronal panoramic plane now, or part of it. This would be a cross-sectional image of the alveolar ridge, and this is the axial plane, okay? So you have basically the lesion on the 3 orthogonal planes here. The thing is that this region is in continuation with the cortical plate, the lingual cortical plate, very close to the submandibular fossa, okay? So we are talking about the posterior mandible, and then we have here the lesion also in continuation with the cortical of the mandibular canal, okay? So you guys are seeing that we have the mandibular canal right here, okay, below the lesion. And then there is no expansion of lingual plate or buccal plate, no aggressiveness, but you do have the lesion. So the first option here of differential diagnosis, and of course you guys should always correlate with the clinical examination as well, but from this image at least we could say that the first option would be most likely periapical idiopathic sclerosis, okay? There are some books saying dense bone island, so this would be, I guess, an accepted term according to some books, but this would be idiopathic sclerosis, okay? And it's periapical because it's also in continuation with this apex here. So if you guys are thinking about condensing osteitis, well, it's not so radiopaque, usually it's not so condensed like this, so it's not the first option, and we have another case to discuss about condensing osteitis. Also, some students of mine said that asked why this is not an osteoma, okay? So osteoma in the jaws, most likely it happens in the peripheral form, okay, not the central form. Peripheral osteomas will be attached to the cortical plate growing outside the alveolar ridge, okay, because they are associated to the periosteum, not to the trabecular bone, okay? So it's 14 times more common to see peripheral osteomas as compared to central osteomas in the jaws, okay? Also, the osteomas will grow around the center of the lesion, will be more symmetric usually, although of course it's a neoplastic lesion, benign of course. And then we have here that this is not the case, right? So this is not so symmetric, and this is more common to be a periapical idiopathic sclerosis, all right? So this would be our first option here in this case, okay? So you basically would follow up the patient to make sure, okay? Now we have here in the middle of the screen, the upper middle part of the screen, there's even a measurement, and this measurement, of course, is a measurement of the horizontal bone loss, so the loss of the alveolar crest. That's the shape of the alveolar crest you guys are seeing here. There is this premolar with root canal treatment, and of course a small radiolucent lesion here, okay? If you guys want to say that this is the PDL space widening, well, you know, this is a little bit too much. I would say that this would be the beginning of a periapical granuloma, right? But then we have this radiopaque lesion, okay? And then what's happening here is that the root is a little bit thicker, right? The root is a little bit thicker. Usually this tooth is vital. We could see the lamina dura and the periodontal ligament space in most of the cases. So this would be hypercementosis, okay? Just like this case over here, right? So I hope you guys were able to confirm that as well. Take a look, even cementum alterations here on the buccal plate, close to the buccal plate as well. But then there is a lesion, of course, a radiolucent lesion, most likely to be periapical granuloma as well, but then we have the roots, okay, the cementum of the root being thicker here in this area, and it's basically the cementum of the root, okay? This is completely different from a cementoma or a cementoblastoma, where you have a radiopaque mass covering this region, okay? If you just type on Google cementoma or cementoblastoma, you guys will realize the difference. Hypercementosis, the tooth is actually thicker, okay? So that's basically the difference, all right? And the tooth would be vital, of course. Well, this on the top right of my screen, we have the mandibular tori. Tori because it's the plural of torus. Okay, I'm seeing on both sides, and of course this is usually what happens, how the torus happens in the mandibular form. Okay, so it happens in the lingual plate, the cervical third of the alveolar ridge, in the region between canines and first premolars, because there is already a paper of our team describing a relationship between parafunctional occlusion and the presence of mandibular tori. Okay, so I will add this reference here as well. And then the last case here, close to myself, is basically a case of condensing osteitis, right? This is an aspect of condensing osteitis. We are seeing this premolar here, and after the premolar, of course, there is a large metallic restoration as well. You would still do a vitality test and percussion test clinically, don't forget about this. So first the clinical examination, but then we are seeing that we have this part of the bone more radiopaque. It's not exactly well limited, maybe partially well limited, but then even after the extraction of this molar, we are seeing, you know, the more radiopaque bone areas in the periapical region of this tooth. Okay, so that's basically how the condensing osteitis happen. What is the difference between these and the others? The cause is inflammatory, of course, right? So sometimes you may find a periapical granuloma or even the radiographic abscess when we have a radiolucent lesion not well limited. Okay, so this is a concept of a radiographic abscess because it's an acute alteration. But then here in this case we have a radiopaque alteration as a reaction to the periapical inflammation. Okay, and of course this is called condensing osteitis. All right. So if you use this video to help your studies, subscribe to support this channel, and if you guys like, please hit the like button, and see you guys on the next videos.